So you think about then, what is that tech stack then that you leverage, you and your team leverage to really help bring to the surface those data points, right? Because there's a whole journey for that data to get from, conception to then realization to then visualization.
BCA has been what's allowed us to really get eyes on everything that's happening in our ED, not just our ED, but the entire hospital. But BCA provides that data that we can slice and dice and look at it whatever way we want, depending on what we're looking for. But it's given us that ability to look at every moment in time in that patient's journey through our ED. And that's what's allowed us to then take those data points and say, where do we need to improve? Do we need to add a second triage nurse because our door to triage is taking too long? And then breaking that out, you can see, what kind of resources do we need to invest in order to make us more efficient and ultimately provide that better care? Taking, the data that we have in BCA, and then not just looking at our ED throughput, but the entire hospital length of stay in the hospital throughput. Because if we can improve how we deliver the care in the ED, we can do the same thing on the inpatient side. So which patients are staying longer in the hospital? And you can look at it by populations of patients, or you can look at it by DRG and start looking at, are we as efficient as we should be in the care of CHF patients or COPD patients? And in some of those, we may be great. Some of them we may, be tripping. So that's where we can focus some attention on. We need to change order sets or pathways or guidelines or put other resources in place to better care for those patients. So you can extrapolate that out through the entire length of stay for that patient. And every hospital, every hospital is challenged with length of stay. And you want to decrease that as much as possible. And that's how you lead to that.